Welcome back to the Best PT Podcast. This is episode 5.6, Integumentary Pathology. This will be the last episode for the integumentary system. Beginning with cellulitis. The cause is a fast-spreading inflammation due to bacterial infection of the skin. Signs and symptoms include localized redness, warm or hot skin, abscesses or ulcerations, chills, fever, and fatigue. The treatment here involves antibiotics and wound care. Contact dermatitis is a localized irritation due to poison ivy, latex, soaps, or jewelry. Signs and symptoms include itching, burning, red skin with edema. Treatment here is to remove the source of the irritation and topical steroids to reduce the inflammation. Eczema is caused by dermatitis caused by an immune system abnormality. Signs and symptoms include red or brown-gray, itchy, leathery skin. Soaps and lotions are known to exacerbate these spots, also called plaques. Treatment involves topical or oral corticosteroids, cold compresses, and diet modification. Dry gangrene is caused by the loss of vascular supply, causing local tissue death. Signs and symptoms include dark brown or black, non-viable tissue, described as mummified. Also cold or numb skin with pain. Treatment involves hyperbaric oxygen therapy, surgery, and pharmaceuticals. Wet gangrene is caused by a bacterial infection of affected tissue. Signs and symptoms include swelling and pain, change in skin color from red to brown to black, pus, fever, and fatigue. Treatment involves surgical debridement, IV antibiotics, and hyperbaric oxygen. Onychomycosis is a fungal infection of the toenails and nail beds. Signs and symptoms include yellow or brown nails, as well as hard and enlarged nails. Treatment involves debridement of the nail and topical antifungals. Plaque psoriasis is caused by a chronic immune disease resulting in red raised blotches that itch and flake. Treatment involves ultraviolet light therapy and prevention of secondary infections. And finally, Dermatitis, or athlete's foot, is caused by superficial fungal infections. Signs and symptoms include itching, redness, peeling skin, pain, odor, and wounds. Treatment involves topical or oral antibiotics and drying and powdering of the feet. That's it for episode 5.6, Integumentary Pathology. This was the last episode of the integumentary system. Episode 6.1 will begin with the metabolic and endocrine systems. As always, the outline will be in the show notes. Thanks for joining me.